Hello. Actually, my name is Mohit. I'm from Mahendar Medical College in Talegaon, Pune. And my question is regarding the USMLE and obtaining a residency in the US. If you're attempting to obtain a residency in the US, other than the steps of USMLE step 1, 2, and 3, is there any other stuff that is expected from us? Research or regarding that, and also how to get such things?
See, there are two aspects here: the legal requirement and the facilitation of getting into a program, right? These are two things that you want clarity on. The name itself speaks about it. United States Medical Licensure Exam. You are legally required to clear those. The answer is straightforward. Without USMLEs, you will not be able to touch a patient in the United States. Period. There's no discussion on that. Secondly, how do you ramp up your CV? Right? For you to be able to get, because around the world people will be attempting the exam and all of them get the 95 percentile or 3-digit scores, 230s, 240s. How do you stand apart is a big challenge for people that are wanting to aspire getting into the US. So there are different ways of doing it. People from the Caribbean, people from the US, or people from US have the opportunity of doing research, which we don't have. So you're left in a more disadvantageous position despite having the top scores. The answer, how do you do it, lies in two. Again, I would say do an MRCP, because that is one qualification that is recognized in the US, but that does not get you any immunity from doing your residency. USMLEs have to be done, but that will certainly help you get into your program. Right? Also, if you go online, www.abim.org, American Board of Internal Medicine, they give a year waiver for doing an MRCP. I've got a year waiver. So your residency program is cut short to 2 years only. You don't do internship, you go straight into your second year and you finish your final year, right? So if the board itself is giving a year waiver, it is recognized that MRCP has got some weightage. So the ideal way of doing it is for people that are not able to do research, try and pursue part 1 of MRCP. It's a dual advantage because just in case you don't get to the US, at least you will be left out with an MRCP. Does that answer your question?
Also, a lot of people have been telling me like ICMR projects also help in regarding getting into US residency, or do they actually count for a big amount?
But the answer is don't believe anything. Let me be very blunt, because that will distract you, that will put you on a different path. Show me one student. I was in a teaching program, residency program, and I was shortlisting the candidates. Very clearly, don't believe all those things. What kind of a research can you do and bring out a publication in 3 years? You have finished your MBBS, you have 3 years for you to get into a career. Research is very important, don't get me wrong. Research is very, very important. I mean, I've done research myself, 3 years of clinical research fellowship in cardiology. It is important, but at what stage of your life and career? If we give you wrong message here, it is going to ruin your lives. Research is for you to progress in the career, not taking it up as a complete career. You should do research, but make sure you ensure your life and safety first. Finish your training, get into a program, done with your training, and as part of training do research, and pursue research beyond your training too. It is important, but at what stage? Not at this stage. Having an orientation toward research anytime is good. So in fact, the Osler's is the one that is running biostatistics course for the entire country, research and biostatistics orientation, the dissection of a paper as it is published. We're not against it, but not at this stage. Okay? So ICMR research is not going to get your USMLE residency program. Answer is that.